Governor Holcomb's briefing will begin in 2 minutes. For the journalists joining us in the digital press room, if you'd like to ask a question, you can click the Raise Your Hand button. When you are called upon, we will unmute your microphone, and then you also will unmute your microphone.
Good afternoon. Thank you for joining us again for another weekly update. Today we have another full lineup, including more about a new effort that will launch later yet this month, before the month's end, with our long-term care facilities statewide. I'm joined by Dr. Weaver today as Dr. Box continues to recover and recoup at home. Appropriately so, but Dr. Weaver will provide us with an update on our hospital and ICU capacity, our positivity rates, and our county metrics map, as well as she will discuss our vaccination plan when they become deployable. And I also think you're going to touch on some ongoing contact tracing efforts and challenges that we've been experiencing really since the outset when we started that. Dr. Box is going to, thankfully, join us by phone. I guess you can't keep a good doctor down, and she's not wanting to be down, but I'm just so pleased that she is able to join us for an update on how she and her family have been getting through this, and really walk through some contact tracing issues and how they've worked for her family personally. And then we'll also hear from the Director of Homeland Security, Director Steve Cox, who is going to join us by telephone as well. He's in Elkhart County right now meeting with local officials and local emergency personnel to learn more about what we can be doing as a partner with Elkhart County and those first responders, those folks who are on the front line. We want to make sure that we're able to address any surge surgically and with precision. Also, last week, I said we'd be back this week to talk about where we stand as of today. Our numbers continue to rise on two main fronts. The 7-day positivity rate, of which Dr. Weaver will talk about, and our hospitalizations. You'll see in just a moment that our county metrics map has a lot less blue this week than it did a week ago. And there are some counties that were red a week ago that are no longer red. That just goes to show you how our rate and spread moves up and down, ebbs and flows all over the state of Indiana. And what was blue one day is not the next, and what was red one day is not the next. This is fluid. And so that's how we have to, again, address this in this fluid situation. That's why I'm asking and continue to ask Hoosiers to do what you know works, and we know a lot more now than we did in March about this coronavirus and COVID-19 specifically, and we know what precautions actually work. We know good old-fashioned Hoosier hospitality is what's really in order in our daily lives. It's not just to protect yourself; it's also to protect your spouse, your husband or your wife or your grandparents or your neighbor or the waiter or waitress at the diner that's taking your order, someone that you don't really know but you're interacting with. So please continue to practice these best practices. Wear a mask, distance when you can't wear a mask, or when you're far enough apart that you don't have to wear a mask. Again, they work, and this is up to us to try to control everything that is in our power to control. And to put a fine point on it, it's especially important for the main topic of our discussion today. Before I do turn things over to Dr. Weaver to get more into the weeds, we are introducing today additional efforts in the coming days in our long-term care facilities all across the state, statewide. We knew in the early days, I think Dr. Weaver and Dr. Box both addressed this at the very first time we got together, that the adverse and disproportionate impact that COVID-19, this pandemic, would have on seniors, especially those with underlying health conditions that are particularly susceptible to COVID-19. And here we sit today and we look at the data, and it tells us that 75% of all positive cases cases of death are with individuals who are 70 years old or older. And we also know that over 50%, about 55% as it was yesterday, are occurring in our long-term health care facilities, residents of those facilities. So this is not unique to the state of Indiana. Doesn't make it any easier to deal with, but it's happening across the nation just because of those traits that I've just described and those underlying health conditions. Again, from the very, very beginning, Dr. Box and her team have operated with a sense of urgency to assist those long-term care facilities, sending in, as you'll recall, and Dr. Weaver talked about this a couple weeks ago, sending in those strike teams to test and reinforce infection control measures, providing PPE, working with the facilities to keep residents and their families informed about cases in hopes of that equipped with that information would help reduce the spread and reduce the COVID-19 transmission, and creating visitation protocols and so much more. But we've really been doing this since the very, very beginning. Still, again, deaths and cases continue to mount at these facilities. Several weeks ago, Dr. Weaver, you shared that there would be a push this month to get our teammates out to complete inspections and do surveys in every facility, about 535, or you might talk about exactly how many. But what we learned there is that we need to initiate an even more targeted, surgical if you will, but an even more targeted effort to support and protect residents where they are. And that means the staff, and that means families of those residents. And they're simply, like so many, overwhelmed by the scale and pace that this virus can really take on. And we appreciate everything that they're doing. There is fatigue there. You're seeing that. We're hearing that when you're on the ground. So over the next couple weeks, we'll take additional steps to directly support and further partner with these facilities, starting with utilizing members of the Indiana National Guard who will work side by side, staff members, and help them with screening employees and data entry and testing and infection control practices, and again, so much more, so that the facility staff members can rightly focus on what they do best, and that's caring directly for the residents. We'll also hire additional clinical staff from among those who have already stepped up long ago, stepped forward and said, put me in. I want to help. I may be retired or I may be new at this, but I want to help. And so we'll continue to put them in, just exactly what they asked to do, as part of our reserve workforce, to visit all of these facilities several times a week to train employees and further train employees on the most up-to-date best practices. And we'll start with facilities. This may sound like a no-brainer, but we'll start with facilities that already have a registered outbreak. And just so you know, I mean, an outbreak by definition is one case. And so we're going to be getting out all over the state of Indiana, starting with those long-term care facilities that already have a registered outbreak. In addition, the state is going to send a lot. I'll leave it to you to go into the details. We're going to be sending a lot of additional PPE, N95 masks and gowns and face shields to all the long-term care facilities, as we have in the past. But this is going to be, again, kind of surgically meeting that surge with our surge of our own. For all of those patient-facing staff members to wear when interacting with residents. We're working to put these pieces in place beginning November 1, and we'll do this for the remainder of the year, and we'll constantly assess our progress, and then we'll be very transparent about that as well, how it's going. The pandemic has taken a toll, as I just mentioned, on all of us, but it's taken a real toll on the residents and the staff and both of their families. And so this, again, is just another step, what we've learned through these surveys, of how we can further help on the ground in local communities all over the state. Our goal is, obviously, the bottom line is to provide some relief for the staff members and the residents, slow the spread among them, and educate and improve all of those known to be working infection control procedures. And by the way, slowing the spread of this infection and sickness inside these facilities there's a direct correlation between how that also impacts our hospitalization rates. You may scratch at that as well. But what happens in the community that ends up in the facility ends up in a hospital. So it's all the same stream. It's either upstream or downstream, no matter where you are, but it's all interrelated. And so it's just critically important that we're there partnering with them and doing all that we can. And we've always used the resources as one of our key measurements: PPE, testing, tracing, capacity, and we'll continue to do that, even localized here at these long-term care facilities. As I just mentioned, we have seen an uptick in our positivity rate in our hospitals in recent weeks, as we see around the country. Nearly 40 states are fitting into this category. So we know it's not just happening here, it's happening virtually almost everywhere. And if it's not happening somewhere, odds are it will be. That's what you see as this virus ravages its way around the world. So if we can prevent infections in our nursing homes, we will protect our hospital capacity and, in turn, our capacity to care for others as well, both in, short-term and long-term, on both fronts. One other thing before I do toss it over to Dr. Weaver and yield the floor. This is somewhat unrelated to the topic of the day in our long-term care facilities, but Janet and Henry, I need to include, and I have decided that in the interest of safety, unfortunately, I have mixed feelings about this, but we're not going to host a Halloween this year at the residence, so no trick or treating at the governor's residence this year. We're going to try to make that up somehow, some way, creatively in the future. Obviously, we're a little disappointed. There's a way to creatively get at doing this, but somewhat disappointed just because this is one of the real fun things that we get to do and to share with the community. I already had my costume planned out. If you watch Netflix and Stranger Things, I thought that was an appropriate series this year. Has some Indiana connections and even had the character picked out that I was going to go as. But that will be for another day, and there will be another season for Stranger Things as well, and come what may next year. And so we're planning on donating our candy that we've accumulated for the big day to a worthy cause, and hopefully that'll put a smile on someone's face. I know, Doctor, you'd probably say pass out vegetables and fruit, but everything in moderation, right?
Right.
And I bet your kids get some treats along the way too. So with that, I'll turn it over to you, and then we'll go to Dr. Box, and then we'll go to Director Cox, and then we'll open it up for Q&A.
Great. Thank you. Thank you, Governor. From day one, Dr. Box said that long-term care facilities were her biggest concern in this pandemic because of the residents' vulnerability and because of the congregate living setting. Unfortunately, we've seen that play out over the last 8 months. While we saw cases decline for a while, we are now experiencing a surge in COVID in our long-term care facilities, which is why we are taking the additional steps to protect our most vulnerable Hoosiers. More than 2,200 long-term care residents have died of COVID-19, accounting for 58% of the state's deaths. We want to save those Hoosier lives, and in doing so, we can also protect our hospital capacity, which is one of our 4 guiding principles. We must take action because we have twice as many Hoosiers hospitalized with COVID-19 compared to late June and early July. As of yesterday, 1,484 Hoosiers were hospitalized with COVID, and we continue to see more than 100 people a day being admitted with symptoms of COVID. Our 5-point long-term care plan is deliberate and a targeted counterstrike to the attack the virus is waging in these facilities. Keep in mind that since the beginning of the pandemic, we have been focused on helping long-term care facilities by giving them tools to protect residents, such as supplies, testing, education, best practices, and an added workforce. We've also deployed our 11 strike teams when needed to respond to positive cases in nursing homes. We shared with you several weeks ago that the Indiana Department of Health will be conducting infection control surveys in every facility in the month of October to assure that all recommended infection prevention practices were still in place. I am happy to report that we will have completed that push by the end of this week, 1 week early. Through this effort, we identified several themes where long-term care facilities could use additional support. Number 1 was staffing. Of all the additional measures that must be in place to protect residents from COVID does require extra time from our staff. Staff members have to isolate or quarantine because of community exposures, and all of these things have brought additional stress to those on the front line. Therefore, the state will be sending the Indiana National Guard to all long-term care facilities to assist with testing and reporting to allow existing facility staff to focus on patient care. The Guard will be trained to assist with screening of employees and simple infection control practices. The work will begin on November 1st and will start in long-term care facilities that are experiencing positive cases, and then will expand to all 535 facilities. Secondly, we are tapping into our healthcare reserve workforce. Early on in the pandemic, we asked Indiana's healthcare workforce that was retired or not employed, or those who were temporarily on hold due to the pandemic, to consider volunteering to help those on the front line. Hoosiers responded en masse. After more than 2 months of no requests for our healthcare reserve workforce, we have received 11 requests for assistance from long-term care facilities just this week. If you are interested in helping, please sign up. The state is going to hire some of these people to expand again how frequently we visit long-term care facilities. We will hire clinical staff from the healthcare reserve workforce to allow all long-term care facilities to be visited at least 3 times a week. This supplemental workforce will be trained on best practices for patient care and infection control. Our third action item is again sending PPE to nursing homes. This time, we are sending 2 million N95 masks to all long-term care facilities. We want all staff to wear an N95 when interacting with the patient, so we are helping to make sure that can happen. The state will also provide 400,000 face shields and 680,000 gowns. This is our largest distribution of PPE to date. Earlier in the pandemic, we have had provided nearly 1 million PPE items to 278 long-term care facilities. So this is an expansion of our ongoing efforts. Our fourth step is a reinforcement of infection control education for employees in long-term care facilities. Department of Health surveyors will continue to reinforce infection control protocols in every long-term care facility. We have sent updated infection control requirements to all long-term care facilities just yesterday. We also are mandating that all long-term care employees complete recently developed infection control education developed by CMS. And finally, in an effort to reduce ongoing admissions to long-term care facilities, we have a new program to allow Medicaid-eligible patients to be discharged immediately to home instead of to a nursing home. As people age and develop medical problems, they are often unable to safely take care of themselves at home. For these individuals, the choice to find someone who can help them in their home or to go to a nursing home. So as part of the public health emergency, we want to make sure that everyone who qualifies for home service can get them quickly. We have applied for and been granted by CMS the ability to pilot a program that allows us to quickly assess and provide individuals with home community-based services. Through the simplified process, what traditionally can take weeks can now be done in a few days. This program is being piloted by providers serving Marion, Hamilton, St. Joseph, Floyd, and the surrounding counties. In the first week this was live, 20 Hoosiers have already been able to return home. I wanted to take a moment to acknowledge our healthcare workforce and acknowledge the fact that they are exhausted. They have been running a marathon at a sprint pace for 8 months, and the human body simply isn't designed to sustain such a pace. These measures are intended to not only protect residents of these facilities, but will also provide some relief to the staff who have been working around the clock to help care for them. I would like to ask all of you to reach out to your family and friends in healthcare, not only in our long-term care facilities, but also in our hospitals and other people on the front line, and to thank them, and to remind them that you are there for them. The overwhelming support from the community was a tremendous boost to healthcare workers in the spring when we went to work not knowing fully what we were up against every day. Now we know so much more about this disease, but the day in and the day out of this pandemic has been long and hard on all of us, but especially those on the front line in healthcare, and they could use another cheer. I also want to update you on Indiana's vaccination plan for COVID-19 vaccine for when it is available. On October 16th, we submitted our interim draft plan to the CDC for review after consulting with a number of cross-disciplinary advisory groups. These groups provided recommendations regarding the ethical and equitable distribution of the vaccine. They will continue to review the safety and efficacy of each COVID-19 vaccine and provide recommendations to ensure that we are reaching all populations when a vaccine is widely available. We know that a widely available vaccine, though, is months away. The latest we've heard is that limited supplies might be available by the end of the year. That means distribution in phase 1 will be focused on the healthcare workforce and those who are at the greatest risk for complications of death from COVID. The CDC will provide feedback on our plan, so this is a draft that is subject to change, and we posted it on our coronavirus.in.gov website and will update it as needed. While the vaccine will be rolled out slowly, there are more immediate steps people can take to reduce the spread of COVID-19. You've all heard us talk repeatedly about the importance of wearing a mask and practicing social distancing, but we also need Hoosiers to participate in contact tracing. I mentioned last week that the number of people refusing to complete an interview has increased. I know that the interview takes time, but it's one of the best ways we have to identify other people who could be unknowingly carrying COVID and spreading it to others. So please participate. During a 2-week period in late September and early October, we were able to identify exposures in places such as restaurants, churches, house parties, small at-home weddings, outdoor festivals, funerals, bowling leagues, and other places where people frequently gather. The variety of locations show that COVID does not discriminate, and it doesn't respect boundaries. So taking precautions such as wearing your mask and social distancing and participating in contact tracing are critical to our ability to stop the spread. And stopping the spread is more important than ever as our case counts increase. This past week has seen the highest case numbers that Indiana has recorded during this pandemic, and our healthcare system is reflecting that increase. we have seen an increase in the number of COVID patients requiring ICU beds and ventilators. About 19% of ICU beds are occupied by COVID patients. Our current ICU bed capacity is just under 35%. Nearly 5% of ventilators are in use by COVID patients. And while we still have more than 77% of our ventilators available, we have recently sent vents to some of the facilities who were running short. All of these increases has impacted our positivity rate. As of October 14th, our 7-day positivity rate stood at 6.9%. Keep in mind that this rate lags about a week behind so that we have time for negative test results to flow in. This allows us to capture a more accurate positivity rate. We know that other sources outside Indiana use different methods to calculate positivity that don't include all negative results or lag time, but we truly believe this method allows for the most accurate assessment of where we are. Finally, I want to show you our color-coded county map. If you had any doubts that COVID is on the rise in our state, just look at the numbers of counties in yellow and orange. Only 8 counties are currently in blue. Those are the counties where transmission is low and no actions are needed. More than a third of counties are in orange, which means medium to high community spread is occurring. 4 counties are in red, indicating very high positivity and community spread. These colors can shift quickly from week to week depending on whether an outbreak has occurred and on how many people are tested. But seeing the map shift so dramatically should be a reason that every Hoosier renews their commitment to stopping COVID in its tracks. I do want to end by focusing on some bright spots because I think we all need good news these days. Currently, almost 99% of our Indiana schools are offering some form of in-person learning. We have shipped nearly 220,000 doses of influenza vaccine across the state, which is nearly the entire amount that we shipped in 2019. And this doesn't account for the hundreds of thousands of doses that hospitals, clinics, and healthcare providers secure on their own. And we are seeing people take advantage of that availability. We are close to 1,000 doses administered to people participating in our latest round of the Fairbanks study and the EMS vaccination plan. Taking action by getting a flu shot is more important than ever this year, so I want to encourage every Hoosier to get one soon. And we will continue to take every possible step to protect the most vulnerable among us. Please do your part. Thank you.
Thank you, Dr. Weaver. And you didn't mention if you were going trick-or-treating or not, but we'll move on to Dr. Box. I think Dr. Box is on the line, on the phone. Dr. Box, it will be good to hear your voice.
Hi, Governor. Can you hear me?
Loud and clear. The floor is yours. How are you doing?
Awesome. Actually, I'm doing great, sir. And I want to start out by thanking you for giving me this opportunity to touch base with everyone. And a special thanks to Dr. Weaver and my team at the Department of Health that are really holding the fort down while I'm gone. It's really a blessing to be able to talk to everybody today and give you an update on how I'm doing and how my family's doing. And honestly, we're all doing great. My daughter, Catherine, and grandson, Liam, have been sick, but they're pretty much back to normal. My daughter-in-law, Amber, did get tested and ended up symptomatic and positive also. She's been pretty fatigued, but I think she's on the mend also. Thankfully, my husband, Dave, has not yet become ill, so I'm praying that doesn't happen. And as it turned out, I was pre-symptomatic when I was talking to you last week because I did develop some symptoms, but fortunately, those symptoms have been very mild, kind of a fatigue, cough, runny nose. And I think really I'm turning the corner on even that. So I really appreciate everybody's prayers that everyone has reached out to me. I do want to take a minute to talk about the contact tracing and to point out a couple of things. First of all, to my knowledge, Liam and the 2 young daycare workers are the only individuals that have ended up positive at Liam's daycare. And I think that's really a testament to the 2 young workers, when they realized that they'd been exposed to the one girl's sister, who is a college-age student and was positive. They stayed home, they got tested, even though they were asymptomatic. They waited until their test results came back. And then when they came back positive, they immediately notified the daycare, who immediately stopped allowing people to come and notified all the families, and therefore potentially dramatically decreased other young children's exposure. I want you to know that I was tested immediately because of the exposure to Liam and stayed home until I got those test results. Dr. Weaver and I pretty much stepped back completely from the contact tracing and did the entire contact tracing that Pam Pontonis, our state epidemiologist, went through with us, that entire interview. Really, we had to look back at 48 hours prior to my test becoming positive because I was totally asymptomatic at that time. And my administrative assistant pulled my schedule and we went through minute by minute, hour by hour, my entire day, reviewed every meeting that I was in. I did have a meeting for about 2 hours with you, Governor, as you recall, on that Tuesday with your staff. But the good news is, in every single instance, not only myself, Dr. Weaver, all of the other people at the Department of Health, the governor's staff, and the governor, we could all say we were socially distanced. We were greater than that 6 feet in most instances. And in addition to that, we were all masked. As you know, out of an abundance of caution, everyone got tested. Everyone's tested negative. And to my knowledge, there have been no individuals that have developed symptoms since this time. I did have a dental appointment, so I had to call my dentist and tell him. But the good news there was that I had minimal exposure mask myself and the front desk people. And then the dental office was all wearing N95 masks. So even though I was with the dental hygienist longer than that 15 minutes, she's not considered a close contact. I also want to say that my family that I saw on Sunday afternoon for a family dinner, out of an abundance of caution, they got tested and they were negative. They did quarantine basically at home, try to make sure that they didn't develop any symptoms or problems. And they fortunately have all not developed any symptoms. And lastly, I just want to say for those individuals who have said that my illness is a perfect example of why masking and social distancing doesn't work, I really need you to think again. Because the only way I got infected was when I let my guard down, which I have done since the beginning of this pandemic, in my social bubble, which is my family, and that's when I got infected. And so I think my case is actually a true testament to the fact that with all my exposure at work for these past 8 months, and even in that 48 hours before I got sick, that social distancing and wearing my mask did make a difference. So thanks, Governor, for the opportunity to share this. I'll be back next week.
I know you will. And we look forward to seeing you when you are fully recovered and your doctor clears you to come back.
Absolutely.
Thank you for joining us today. And with that, we will go up to Elkhart County to the Director of Indiana's Homeland Security. Steve Cox, are you with us? Steve, I got the thumbs up. In fact, I got the double thumbs up that you're with us. You want to come back?
Governor, can you hear me now?
Now I can hear you. We are connected, and so can everyone else.
Great. Well, thank you very much for having me on the call. As you well know, the State Fire Marshal Office resides in the Indiana Department of Homeland Security, and so we're working currently with the State Fire Marshal's Office, with local fire department and fire marshal staffs to provide education and support to organizations that are in counties that are seeing upticks in COVID cases or find themselves in the red or orange category and request assistance of the state. So this is, I just want to be very clear, this is an education campaign to help building owners understand how to minimize risk to their staff, customers, and other people that may use their spaces. So the key for us is to be able to go in and provide any answers and support and information to those building owners that they're asking for. So currently, we're providing outreach in Elkhart, St. Joseph, and Vanderburgh counties as requested by local entities. And in fact, so today, this afternoon, I'm actually in Elkhart County, meeting with officials to discuss efforts being undertaken locally and how state resources can assist their efforts. So I've met with emergency management, fire, EMS, and other officials in the county and to discuss PPE distribution, medical direction issues specifically associated with EMS response, and coordination efforts with different state agencies is just a couple of examples of things that we're talking about today with locals. Additionally, our office has coordinated with them to provide staff and policy support in response to long-term care facility issues that interface specifically with EMS and other COVID-related issues dealing with response issues. I'm actually headed right now to the Elkhart City Fire Department for an additional meeting with the Elkhart Fire Department administrative staff to discuss response issues there. And so this is all being done as an effort with the State Department of Health to support Dr. Box and Dr. Weaver's staff efforts. Thank you, sir.
Thank you, Steve. Be safe, and we'll see you back at the ranch when you get back. Rachel, can you go right to, we're a little over the 3 p.m. hour.
We'll begin with Eric Berman with WIBC.
Good afternoon, Eric.
Good afternoon, Governor. And if Dr. Box is still on, hope you continue to do better. Couple of questions. I wonder if you could clarify what the Healthcare Reserve Task Force is going to be doing. If I'm following you correctly, they're not going to be staffing the facilities. So how exactly are they going to be assisting? And secondly, we're still at stage 5. There's been some criticism amid the campaign. I wanted to ask you about one point that your opponent has made, arguing that people aren't reading the Back on Track website. They know that there's 5 stages and we're in the 5th one, and they assume that the restrictions are gone. How does one address that and make it clear that that people still need to take precautions, or do we need to go back to stage 4 or 4.5 to accomplish that?
Yeah, I'll take the second question. If you look like you were taking some notes on the first question, well, go ahead and you can take the first one, and then the camera's on you, so we'll.
Okay, so
Both of you.
You're right. For the healthcare workforce reserve, it has been active since we implemented it in the spring and has always been available. We've been in constant communication, actually, with the people that signed up to be in the healthcare workforce reserve, and it's been available for long-term care facilities or hospitals who needed support for staffing, and they're able to go online onto the coronavirus.in.gov website and then actually request exactly what kind of healthcare provider they need, whether it be a nurse, a respiratory therapist, or a physician. So we have not had many requests, as I mentioned, for the past couple of months, I think, as things were getting better, but we have had several requests, 11 just this week, to assist in long-term care facilities. So what we do is we'll reach out to the people on the healthcare workforce reserve and ask them who is available, who is in this area, willing to go actually help out, provide staffing, and to be hired, whether it be temporarily or long-term, at the facilities. In addition to that, the Indiana Department of Health is also looking to the healthcare workforce reserve and to hire some of them and helping us go out and make sure that we are touching base in all these facilities up to 3 times a week. So that's our plan. We want to be everywhere 3 times a week, maybe more. And so we're going to utilize the nurses and the other staff on there to help support that.
We're going to flood the zone, Eric. Let me just say, in terms of your second question, Stage 5 has got nothing to do with any campaign. This has got to do with safely getting back to school, getting our economy fully open to the extent that it can be safely, and that's happening all over the state of Indiana. This Stage 5 is not dependent on a website. That is a repository of where we are, but we are constantly, day in and day out, working with local health departments, working with schools, working with businesses, working with local leadership, mayors, commissioners, we're all in this together. It's not wait for something to be or review something on a website. This is promoting best practices. Now, you highlight Stage 5 in your question, and I just would like to kind of rewind the tape a little bit about what Dr. Weaver said, almost in passing, about we know a lot more now than we did at the very outset. We also, in addition to that was it's still a new virus to the world, but it's not novel. It was really novel when it all washed upon our shore, and we all had to, basically start from zero, or a flu playbook, and addressed this virus, which was on a scale of, the last one being in 1918. And so what's different about now and where we were in March? Number one, Our PPE inventory is in solid shape right now. Recall back in March when we were dependent on church groups to make masks, and students and everybody under the sun was helping pitch in to make sure that our healthcare system wasn't overwhelmed by the initial wave. And so our PPE inventory, as you just evidenced, sending 2 million out to our 535 long-term care facilities, much different place. Our capacity to care and our network, which is part of our guiding four principles, our staffing, our hospital, the rooms, the ventilators, all those things that you went through. We have capacity to care in stage 5, where we currently reside. We know how to fight back. Back to what Dr. Weaver said, we know a lot more about this. We know how to fight back. We know we can control what we can control. And that has to do with distancing. That has to do with masking up. That has to do with good hygiene, all those best practices. So we know in stage 5, and by the way, we have proof it works. Look at our schools. And so, do you want us not to be back in school? Do you want to go back? Because we're proving, as are other states, that this is not originating in our schools. Why? Because they are enforcing best practices. And so the stage 5 is much different. And by the way, just to round it out with a couple more reasons why, we have testing and tracing capability that we did not have on day 1 or 10. We were doing on March 23rd is the date that I think that we went to the hunker down posture and position. We were doing I think we reported 1,500 tests being done that day. Now we're doing 15,000 or 20 or 25 or 35,000 a day. And so those tests help us then trace and figure out where the cases are occurring, whether it would have been in stage 1 or 5, where we are right now. And what we're learning from our tracing efforts, this is very important. What we're learning is these outbreaks are happening at maybe not the wedding, but at the after wedding party reception at someone's house. They're small events. They're picnics in the backyard. They're where we do, as Dr. Box just mentioned, let our guard down. And so that's why it's critically important, no matter what state you're in, that there is the state and the local partnership, and those resources are combined, feet on the ground, and that's why we're doing all we can to continue to assist and take some things off the plate so that in our long-term care centers, like we talked about today as an example, those staff members in those facilities can, like I said, do what they do best. So stage 5, we're proving it, whether it's making cars or going to a Colts game or going to school, there are safe ways to be in stage 5, and we're proving that all over the state of Indiana.
Brock Turner, WFIU.
Afternoon, Brock.
Good afternoon, Governor. Thanks for having me on, and Dr. Weaver. Just have an initial question for you, Governor. During yesterday's debate, you said, quote, "Our individual liberty needs to be guaranteed," end quote. Is it safe to say that you are not planning to implement any more statewide stay-at-home orders or reverse reopening policies or implement any mask wearing penalties at the state level?
Look, we're not, Brock, we're not living in a police state. And our liberties do need to be protected. And I also mentioned that they shouldn't infringe or harm someone else. So, we can go through the mask, why masks are safe, till we're blue in the face. But we know that they are. And we know that they're not just, they help you, but they also help your neighbor, someone who you may not know or ever see again. And the last thing that we need to do is go back, and the last thing I want to do or need to do is go back to a stay-at-home. By the way, when we didn't shut the state down. We said we've got to get our footing. When this thing first, the first wave came, we have got to get our PPE inventory up. We've got to have our hospital networks operating as one, so we're very efficient, and we have to make sure that we have the capacity to care. We have that now, and we're proving it can work. And so where we need to make improvements is on the front of our what we can control, and that's individual, and that's very localized. What you're seeing around the country where this is working are, as we mentioned, addressing surgically where the surge is. And if you look at different counties, it's important, number one, to whether they're urban, rural, or suburban, it's important to look at where are the cases coming from. It may be at a nursing home in one county and 4 counties away. It may be at a Department of Corrections facility, or it may be because of a church service, 5 of them up where Steve Cox is that were just recently reported, where it's traced back, where an outbreak occurred. So it's different all over the state of Indiana. The state will continue, in terms of masks, the state will continue to work with locals to educate and encourage these best practices.
Nikki Kelly with the Fort Wayne Journal-Gazette.
Afternoon, Nikki.
Hello, I have 2 quick questions for you. First is I wanted you to explain a little better. Last week you said the blanket approach doesn't work, and it seemed to work for months. We got our numbers down to the lowest amount. So
no, actually, Nikki, we started with a very targeted approach. If you remember, Marion County was treated differently, Cass County was treated differently, and throughout the different stages, as we got our footing, there was no blanket approach. We dealt with this very surgically, and once we have the capacity statewide, when we're looking at those numbers, the beds, the staff, the hospitalization rates, et cetera, ventilators, then we were able to move statewide throughout the stages 2, stage 5, where we're still safely able to do that.
Okay, I just wanted to follow up real quick on one other thing.
Sure.
Will you be attending Mike Pence's rally in Fort Wayne Thursday? And also, do you think it's a wise decision to have hundreds of people attend that rally?
If it's safely orchestrated, and that's what we'll review, when I finalize whether or not, I likely will, by the way, I'm not trying to avoid your question, I likely will, we need to finalize it on my schedule, but we'll obviously, if we do, follow all the Secret Service protocol. I'll be tested before I go. I'll share those results with you, and I'll be masked up. And if I can't be distanced, I'll be masked up, just as I was the last time I was with the Vice President when he was at Marion University.
Scott Reynolds with WDRB.
Good afternoon, Scott.
Hey, thank you so much, Governor and Dr. Weaver. Appreciate your time. As we look at these long-term care facilities being such a problem for 7 or 8 months now, and you've loaded them up with a lot of resources, is there a way to stop workers from going facility to facility? Because sometimes, a company will own 5 or 6 and they're short of staff and they're moving amongst so many patients. And then second question would be about masks. As we look at maybe half the population in some of these polls not willing to take a vaccine. Are we going to have numbers? Is it very likely? I know we got to look at it month by month as a state has to, but would it be reasonable to say we will be wearing masks through the next year as there are still cases popping up amongst those who don't have a vaccine?
You want to take the transient nature of long-term care staff members?
Yeah, absolutely. So we do recognize that this is something that has occurred before now, but especially when you're having difficulty with staffing facilities. When there's an outbreak in facility, often it starts with the staff, and several of the staff members spread it to each other, and then of course, ultimately it could end up spreading in the residents. We have talked to the long-term care facility associations and long-term care facilities about how we can really, practice the best recommendations, and acknowledging that staff having to go to different facilities may have to continue to occur so that we can take the best care of the residents. That's why really the focus goes back in how do we prevent the spread from the staff to the residents. And we do that by making sure that there's active screening when staff show up to their shifts. So whether it's, questions about, have you been around anyone with COVID? Do you currently have any symptoms? Often they will go ahead and take your temperature at that time. And then making sure that everybody is wearing their masks. If everyone is wearing their masks, residents are wearing their masks, the staff are wearing their masks, they're not eating close to each other or doing other activities outside of work together, which we've unfortunately heard about too, that lots of staff members had a birthday party and they all spread it to one another. And then, of course, that ended up affecting the resident facility. So I think there's ways that we can do both, but it is something that we're aware of and we have discussed with them.
And to answer your other question, Scott, I think you're right. I think as long as there is spread of this virus, we need to practice all the best practices, the things that we know that work, and masks are one of them. Distancing is another. Good hygiene. Again, not to sound like a skipping record, but we're not going to get away from those things that work. And yes, we're hopeful, and Dr. Weaver reported on our vaccination plan or rollout when we deploy. When that day comes, don't know exactly when that day is going to be, but as more therapeutics and vaccines come, we'll continue to look at the numbers. But as long as they're spread, we have to do what works. And that's just, masks are just one thing that we know can help slow the spread.
Kayla Sullivan, Fox 59.
Afternoon, Kayla.
Good afternoon, Governor. Are there any current visitor restrictions at long-term care facilities? And if so, what are they right now? And then if not, what would it take for those to go back into effect?
Yeah. You want to talk about the protocol that's there already? And
Yeah, so we, again, for one, in the beginning, we did restrict all visitors, and that was for a little while until we learned about what measures can we put in place where visitation could be done safely. One of the ways that we found that visitation could be done safely is doing it outdoors, making sure that the visitors are wearing masks. They're also screened about any COVID symptoms, and if they've been around anyone that's had COVID, the resident and their family are kept 6 feet apart, and again, wearing masks. And then outdoors, as we know, really decreases the spread. Of course, there are times where visitation has to happen inside, whether it may be somebody who can't move to outside or, of course, weather or whatever it may be, and we're starting to move into those months. So we're working on ways where we can make sure that we do that in a safe way. If there's an outbreak in a facility, then yes, visitation is going to be restricted. To protect the residents, a lot of focus has to be done on making sure that the residents are cohorted. There's lots of testing that is done, and so we want to make sure, that all that is a primary focus, and so visitation may be restricted during that time. However, we also know that it's really important for the people who live there and for their families to be able to see each other. So we're going to continue to work with the facilities to make sure that visitation can happen in some form, again, as long as there's not outbreak testing. But even then, to make sure, do they have iPads? Are they calling each other on the phone? What are the other creative things that we can do and that we have supported as a state to make sure that people can continue to stay connected? Because we really do believe it's important to their mental health, which then affects their physical health.
yeah, and you might, before we move on, just to underscore, Dr. Weaver, you might talk just a little bit about, these cases, again, the importance of knowing exactly where outbreaks are occurring, whether it be a nursing home or long-term care facility. Talk about the difference between, and the testing that's available, and the difference between those positive numbers in a rural county versus maybe an urban county, or the number of testing sites that are available, and who's walking in to get tested. If we have the capacity to do 35,000 a day, it doesn't always happen, and the numbers can look disproportionate. That rate looks different in, say, Ohio or a Switzerland County versus a Elkhart, Vandenberg, or Marion County.
Yeah, thank you, Governor. That's a really good point. So in the beginning, when we had very limited testing, it was almost all symptomatic people that were going to get tested. And so we had percent positivities of 20, 25% on some days. But now that we have more testing available, and people even with mild symptoms or maybe no symptoms, but they were a close contact to somebody, or maybe they feel like they were exposed, they can go get tested. So that honestly adds to decreasing the percent positivity. But when you look at individual counties and they have a smaller population, maybe they only have have one testing site and they only test 100 people in 1 week, and then you have 20 of them that end up positive because, they have to maybe go out of their way a little bit to get tested, and so they're only going to seek testing if they're symptomatic, that might increase the positivity in some of those areas. Not that it's not important, and it is, and something that we should pay attention to because, they've had the same testing week after week, but it does affect the numbers, and that's why you might see the positivity rate fluctuate a bunch from week to week.
Right.
Kathy with the Ferdinand News.
Kathy, good afternoon.
Good afternoon. Governor, I beg you to wear your Stranger Things costume next week at this time. I'd love to see that. Love that show as well.
Well, I can nerd out with the best of them, so there you have it.
Good deal. Well, thank you. Dr. Weaver, you guys have been in the trenches this long. I keep hearing, but I don't see specifics or hear specifics, that people following having been tested positive and maybe being asymptomatic are having repercussions later on. Is that correct? Are you seeing that? Would that be a deterrent to people to say, okay, well, because I've heard people say, I just want to get it and have it over with. And I think that's not a good attitude, but
Yeah, I agree with you. We have unfortunately seen that. A good example is our MIS-C cases, so the multisystem inflammatory syndrome that we see in children. Often that is after they were infected several weeks. And thankfully, we've had very few cases, 19 in the state of Indiana, and everyone is recovered or actively recovering right now. But we did also find out that this can happen in young adults. And really, that's the group that feels that they are the most invincible. But they can have that same symptoms or that same syndrome where they'll be infected, maybe not have very minor symptoms or no symptoms at all, and then several weeks later they get cardiac problems, they have to be hospitalized, different organs shut down. It's very serious. So I totally understand the idea of people thinking that they want to just get over it, but sometimes we don't know. We know there are certain risk factors that make you more prone to being severe illness, but it also happens to the severe illness happens to people who are totally fine, young, and healthy otherwise.
Yeah, and it moves so fast. So it's in addition to any short-term or long-term adverse effects it would have on you, how many other people have you now passed it on to that
Exactly.
aren't in the situation of model health that you might be in?
Rich with WTHR.
Afternoon, Rich.
Good afternoon, Governor. My question is, at what point, is it now or is it later on, at what point will you, if you consider extending the mandate for masks? I travel places in Indiana, I travel places out of state. In other states, they're not messing around.
Yeah.
Signs are up in door
That's right.
windows at restaurants and businesses and say, wear a mask or stay out.
Yep.
I come back to Indiana and frankly, I was kind of appalled by the number of people who aren't wearing a mask. Are you going to extend the mandate or enforce it?
Well, we're going to continue with what works, and it's working right now. And I don't have a date or my crystal ball. I'd love to get to the day when we don't have to wear masks. That's in part, going to be up to how we control the spread. It's going to be in part with therapeutics and vaccines. So there's a lot of factors, but we're going with it for the foreseeable future right now because it works, and we don't have therapeutics and a vaccine, and we're not seeing the spread rate go down or taper off. And so we'll be at it as long as it works. Now, I will say this, Rich, though. I get people that send me signs that they put up. I've been in multiple facilities over this last week, and all of them had signs. And so that signage is really important on Main Street, not just in our larger employers, but in our smaller as well. Same true at schools and college campuses. So I actually see a lot of signage that's up, and I don't think it's just because of me, because I'm somewhat of an impromptu stopper sometimes when I'm out on the road. And that goes a long, long way to not just slow the spread, but increase customer confidence that your business is open and safe and that you're not going to be subjected to an unsafe environment.
Our final question is from Samantha with WFIE.
Afternoon, Samantha.
Good afternoon, Governor. Thanks for a few minutes of your time.
Sure.
I
Thank
have
you.
just two quick questions, and they may be better directed to Dr. Weaver. But as you guys know, down here in Evansville, we serve a tri-state region, which of course includes Kentucky and Illinois. So when we compare county metric maps between the states, we're finding that sometimes neighboring counties could report, nearly the same number of cases, but look much differently, because here in Indiana, we use that 7-day positivity rate to also influence the color.
Yeah.
So my first question would be, why keep using that as a second metric when it could be, I guess, from my understanding, influenced just by the amount of testing?
So that's a good question. So we use the positivity rate and also the cases per 100,000. And really, that's why we want to do the combination, because it tells you of all the people that are seeking testing for whatever the reasons may be, how many of them actually end up positive. But then the cases per 100,000 really tells you, okay, when you look at the full population, how many of those people are positive. So we really appreciate the combination of the two, because we think it gives a better and more clear picture, specifically looking at those different counties and the number of people that live there.
And my follow-up question to that would be, our friends in Kentucky are seeing high spread along that I-69 corridor leading into and out of Evansville. But here in Vanderburgh County, people say, oh, we're fine, we're not in the red, because again, our metrics are different than Kentucky. So what would be your message to folks in that regard?
I think that I would talk to your friends and family in healthcare, listen to your local health officers, your elected officials. We have been in constant communication with the district down there because they have had such an increased number of cases and also hospitalizations. So I think that really you have to look at the numbers, talk to the people who are on the front line and taking care of people, that we really need to make sure that we're diligent, especially in the areas that we're seeing an uptick and kind of a hot spot of cases. And Vanderburgh County is one of those places.
Yep. Control what you can control. I mean, you're going to be a difference maker for the good or the bad, and these are a few simple things that will go a long, long way to relieve that pressure that's on our healthcare system. And that's what will allow us doing things the right way, the safe way. That's what will help us not just get through this, but get through it safely and save lives while we're at it.
Thank you for joining today's briefing. Governor Holcomb's next briefing will be next Wednesday at 2:30 p.m. Eastern.